Okay, imagine this scenario. You've been feeling, sluggish, tired, maybe a bit down. You finally get some help, maybe start on testosterone replacement therapy, TRT, and things start looking up. More energy, better mood. But then, boom, a new term pops up on your lab results. High hematocrit. And suddenly there's this new medical thing to figure out. Welcome to the deep dive. Today we're getting into something really relevant for anyone on or even thinking about TRT, high hematocrit. Sounds technical, right? But we're going to break it all down. We'll cover what hematocrit actually is, why TRT can make it go up, the health risks, which can be surprisingly serious, and most importantly, what you can actually do about it, how to manage it. Our goal here is really to give you the essential info, kind of a shortcut to understanding this.
Yeah, this is such a crucial topic if you're navigating TRT. And understanding these, let's say, nuances isn't just about ticking a box for a side effect. It's really about looking after your long-term health. We've basically sifted through a lot of expert sources to pull out the absolute must-knows for you so you get it without getting totally swamped in medical details.
Okay, great. So let's start right at the beginning. For those of us who aren't, hematologists, what exactly is hematocrit and how does it fit in with other things we hear, like hemoglobin or red blood cell count?
That's the perfect place to start. So hematocrit, or HDT, it's basically a measurement. It tells you what percentage of your blood volume is actually made up of red blood cells. Imagine spinning your blood down in a tube, right? The red cells pack at the bottom. Hematocrit is the percentage that layer takes up compared to the total blood. Now, hemoglobin, HB, that's different. It's the protein inside the red blood cells, the iron-based part that carries oxygen around your body. That's measured in concentration, like grams per deciliter. And then red blood cell count is just a symbol count of how many red cells per microliter of blood. Doctors usually look at, 2 or more of these together. But a quick rule of thumb, hematocrit percentage is usually about 3 times your hemoglobin number.
Ah, okay, that helps clear things up. So 3 times the hemoglobin, roughly. What are the sort of normal ranges we should be aware of, like when we look at our lab reports?
Right. For men, normal hematocrit usually falls somewhere between, say, 41% and 50%. For women, it's generally a little lower, maybe 36% to 48%.
Okay, so let's get to the connection here. You start TRT, you feel better, but then this high hematocrit thing shows up. Why? What is it about testosterone therapy specifically that tends to make this number climb? It seems, counterintuitive sometimes.
Yeah, it does, but there's a clear mechanism. TRT is actually a pretty common cause of what's called secondary erythrocytosis. Fancy term. But it just means your body makes too many red blood cells. And the way it works is, testosterone lowers a key hormone called hepcidin. Hepcidin acts like a gatekeeper for iron absorption in your body. So when testosterone tells hepcidin to kind of chill out, your body ends up absorbing more iron, and the signal goes out, make more red blood cells, more than you might actually need. And we generally consider it erythrocytosis in men when hemoglobin gets above 18.5 GDL and hematocrit goes over 52%.
Wow, okay. So TRT basically messes with the body's iron regulation system, leading to this overproduction. What does that actually mean for health, though? Why should we really worry if that hematocrit number is just, creeping up a bit, a few extra red blood cells? What's the big deal?
Well, it is a big deal, unfortunately. When hematocrit gets too high, your blood literally gets thicker, more viscous. And that significantly ramps up the risk for some really serious stuff. We're talking strokes, heart attacks, blood clots, specifically venous thromboembolism. You get these tiny clots forming that can break off, travel through your veins, and cause blockages anywhere. Lungs, brain, heart. Very dangerous. And it's not just the immediate acute risks, there are longer term worries too. See, elevated hemoglobin often goes hand in hand with unhealthy levels of stored iron in your body tissues. And this excess iron, it's linked to oxidative damage. Think of it like rusting, but inside your body. And that damage is associated with heart disease and even dementia over time.
Yeah, that connection to dementia and cognitive health is really striking. It's not something people immediately think of with blood thickness, right? But the research seems to point that way.
It absolutely does. It's becoming clearer. We've seen studies showing, for instance, that both low and high hemoglobin levels in older people are linked to lower cognitive function, especially in things like semantic memory and how fast you process information. And another study was quite direct. In older folks without dementia, having hemoglobin levels that were either too low or too high increased their risk of developing Alzheimer's later on. And it also sped up cognitive decline. So yeah, keeping hemoglobin and hematocrit in that sweet spot, it seems really crucial for brain health, not just heart health.
It's definitely a bit stressful to hear all this, especially if you're someone who's finally feeling good on TRT. It feels like trading one problem for another. But like you said, understanding this is the first step, and the really good news is there are ways to manage it.
Exactly. And that's key. While, yes, some doctors might just say, stop the TRT, that often throws people back into feeling awful, losing all the benefits. But thankfully, no, there are several really effective ways to bring that hematocrit down or even prevent it from getting too high in the first place. You can often stay on TRT safely.
Okay, that's definitely reassuring. So if someone sees their number climbing, what's usually the first line of defense, the most direct action? I've heard donating blood is key.
That's often the go-to, yeah. Donating blood therapeutic phlebotomy, if it's medically necessary, is a tried and true method. It directly removes red blood cells, lowering both hemoglobin and hematocrit. Plus, you're potentially helping someone else out, which is great. Generally, giving 1 unit, which is about a pint, can drop your hematocrit by roughly 3 percentage points. Pretty effective. It's often recommended to think about donating when you hit that 51-52% range. But there's a caution. Don't do it too often. The Red Cross, for instance, suggests waiting at least, 2.5 months between donations? Otherwise, you risk depleting your iron stores, your ferritin too much, and that can cause fatigue, which kind of defeats the purpose of feeling better on TRT. Also, just be aware, if your hematocrit is really high, say over 53%, some places like the Red Cross might actually turn you away for regular donation. In that case, your doctor can order what's called a therapeutic phlebotomy specifically to lower the number. You do that at a blood center.
Right, okay. Good practical advice there. So besides actually removing blood, what else can people do? Are there adjustments to the TRT itself? Or maybe lifestyle things?
Oh, yeah, definitely. There's quite a toolbox of strategies. We can kind of group them. First, thinking about the TRT itself, lowering the dose. This is often the first thing a doctor will look at. It's possible, even common, for men to be on a slightly higher dose than they strictly need. Just dialing it back a bit can sometimes be enough to get hematocrit under control without losing the benefits. Switching how you take it. This is interesting. The way you get your testosterone seems to matter. Creams or gels, the transdermal options, they generally seem to raise hematocrit less than intramuscular injections. There was one study showing subcutaneous injections that's under the skin, not deep muscle, led to like a 41% lower hematocrit compared to IM injections, but still gave a good boost in testosterone levels. So definitely something to discuss with your doctor. Okay, then there's lifestyle and other health factors. Hydration. Seriously, drink enough water. It sounds basic, but your hydration status directly impacts blood concentration. If you happen to be dehydrated when you get your blood drawn, your hematocrit might look artificially high. Worth asking for a retest if you think that might be the case. Thyroid check. Your thyroid function can play a role. Hypothyroidism and underactive thyroid can sometimes lower red blood cells, while hyperthyroidism, overactive, might raise them. Getting a full thyroid panel checked makes sense. Sleep apnea. This is a big one, often missed. If you have undiagnosed sleep apnea, you're not getting enough oxygen consistently during sleep. Your body tries to compensate by making more red blood cells and hemoglobin. This creates what's called a hypercoagulable state, basically. Thicker blood, higher clot risk. So if your hematocrit is stubbornly high, getting checked for sleep apnea is really important. Stopping smoking. Obvious, maybe, but crucial. Smoking lowers oxygen in your blood, triggering your body to make more red blood cells to compensate. It's a direct cause of high hematocrit for many. Inflammation. Chronic inflammation from whatever source can actually mess with that hepcidin hormone, again, potentially leading to more red blood cell production. So looking for and treating underlying infections or sources of inflammation, maybe checking your CRP levels could help. And then finally, maybe some more specific or emerging things. Red meat intake. Red meat is high in heme iron, which is easily absorbed. Too much iron contributes to oxidative stress. Some studies show vegetarians tend to have lower hemoglobin. Reducing red meat intake might help manage iron levels and, indirectly, hematocrit. Plant foods also have phytic acid, which can bind iron and reduce its absorption. Curcumin turmeric. It's known for being anti-inflammatory. There's some early research suggesting it might bind iron in the gut. Interesting, but needs more study, and you'd want to discuss it with a doctor, as there have been rare reports of it causing iron deficiency anemia. Losartan for blood pressure. If you already have high blood pressure, this specific medication, losartan, has shown it can help normalize hematocrit in some people, potentially avoiding phlebotomy. Shows how interconnected things are. Grapefruit, maybe. There's some research on grapefruit extract, specifically Narogen, potentially lowering hematocrit. But huge GE caution here. Grapefruit famously interacts with many medications, increasing their levels in the blood. Absolutely essential to talk to a doctor before trying this one. Don't just add grapefruit juice thinking it's harmless.
Wow, okay. That is a really comprehensive list. It's great to know there are so many different angles to approach this from, not just, stopping the therapy or constantly donating blood.
Yeah.
So boiling it all down, what would you say is the single most important message for someone listening today?
Really, it comes down to monitoring. Consistent, regular monitoring. Checking your hematocrit and hemoglobin levels every few months while you're on TRT is absolutely vital. That's how you catch it early if it starts creeping up. And that allows you and your doctor to use these strategies proactively to minimize those cardiovascular risks and maybe even the cognitive ones we talked about.
Yeah, that makes sense. This whole deep dive really drives home how, interconnected everything in the body is. You tweak one thing like testosterone and you have to watch for these other effects. It's not isolated. It definitely makes you think. What other health factors that seem separate might actually be playing a hidden connected role in how you feel overall? Something to ponder.